We've upped the ante on this episode of Health in 2.00. We've got more than $300 million of deals. Matthew Holt is locked in a sweltering box that's approaching 95, 98 degrees, and there's a murder hornet that we've unleashed on him. It's this episode, the May 28th episode of Health in 2.00.
There's the murder hornet.
Oh my God, there it is. How are you going to do this? I like that we're introducing an element of danger. Are you allergic?
I think we'll have to hope. If I can put it behind the blind that it doesn't notice me and that it doesn't try to come and kill me or attack my beehive or whatever.
Ooh, what else can we put in there?
I think that this is a bit like that Japanese game show they used to do in the 90s where they were like, you call it endurance, and they would like torture people and see how long they can last. And we'll see what happens if I get attacked. Maybe it'll bump up the speed of my responses in order to get out of there.
How did it take us this long to introduce some sort of animal that could hurt you?
I tell you, because
why did no one write
it's so hot here and all the windows are all open. We have got so many animals in this house. It's terrifying.
Oh my God, put your blood pressure cuff on. Let's just watch this.
I'm not doing that during this. I may not make it.
Okay. I have so many deals to talk through with you.
Okay, we're ready to go?
Yeah, do you have your timer?
Okay.
Is it going? Yep. There it goes. Okay. Amwell gets 194 million big ones. Matthew Holt.
I think that this means Roy, and he does show him back. Roy will have to buy a new yacht because the one he's got right now is a bit small. Okay, but seriously, they never made it public. We're not quite sure why. Maybe the numbers weren't quite good enough last year, but they were a logical candidate to go out. They were at Health 2.0 when they've launched in 2008 in February or March, I believe it was. So they've been around a long time and obviously have grown dramatically. Got the deal with Cleveland Clinic and a bunch of other stuff. This, I guess, is an alternative to going public, but you will go public pretty soon, clearly in the next wave as soon as they can get out.
Ooh, we'll come back to that. Okay, we'll come back to that. Mindstrong is 100 million. This is another big one.
Yeah, I don't really quite understand what's going on here. There were some rumors that the stuff they were doing with California counties wasn't working so well. It's a mental health app that kind of judges some of the stuff that Ginger.io was doing back in the day, years ago. Sort of trying to figure out from your use of your phone and other stuff what's going on with you, and then introducing you a whole bunch of mental health stuff. My friend, British doctor Cosima McGrattan, works there. One day I have to figure out what they actually do. $100 million and a new CEO from Uber sounds like a lot in a very, very crowded space, but maybe they'll make it.
All right, seems another one in that crowded space. Big Sky Health lands 8 million. This one's a little different though.
Yeah, this is kind of weird, right? So they have like stuff for intermittent fasting. They said 800,000 people have all been fasting intermittently for a long time, and then they have no alcohol.
Yeah,
so you don't drink, you don't eat, and then you do meditation to calm you down. Sounds like a lot. Very crowded space, but good luck to them.
All right, what about Tava Health? They get 3 million to expand their teletherapy program.
Even more crowded, but these are nice boys from nice Mormon boys from Utah, so bound to work.
Ooh, finally, one that's not mental health. How about Medwing? German startup gets 28 million euros, 30 million US.
Yeah, this is kind of interesting. There's been a little bit of this going on in different segments. This is in the world of sort of matching doctors and healthcare professionals to open slots. There's a couple of these. There's a bunch of these. There's a couple in the physician world who are specialized. There's a couple in the nursing world, and there's some of the sort of the at-home post-acute care world. A bunch of companies in that space. This seems to be trying to do it all. Don't know this company at all well, but they have apparently employees in 20 countries. So it's a big jump on that sort of temporary staffing, making it all work, getting people to the right slots. And I assume post-COVID, this is actually going to be more important rather than less. So it's probably a good deal.
Yeah. We didn't even get to my list of May Mental Health Month partnerships. I've got like partnerships galore here.
Oh, well, that's all in the 2 minutes. So maybe we'll never find, maybe those partnerships don't exist. If they don't get covered in our 2 minutes, do they happen really? Well, I do know that Meru got one with Cigna. I think Cigna had one with Talkspace as well.
Cigna did one with Talkspace and with Meru, so
And I
rolling
think
out different benefits there. And then the other one was Calm, which to me, I mean, I feel like we hadn't heard from Calm in a while. They rolled out a partnership with Amex, offering this for free now to 49 million Amex members as a benefit.
Well, I mean, that's what you need. If you're rich enough to have an Amex card, you're probably screwed up enough in the head that you need that.
Matthew Holt.
Okay. And then what about, they had to deal with Kaiser?
Yeah, they had to deal with Kaiser as well to roll that out. So I saw that email come through. I'm a Kaiser member. I was pretty excited to see that. I got my strength now. I've got Calm. I'm like, I should be set here for the rest of this pandemic.
Be completely fine and not, Now, do you want to tell us something else about Kaiser?
Yes. So today, later on today at 1 p.m. Eastern, 10 a.m. Pacific, I will be hosting a webinar for AHIP that features both Kaiser and Livongo, and Livongo's talking about their MyStrength solution that just got integrated into Kaiser and rolled out nationwide. So the conversation we're having though is about digital self-care and how to like build an ecosystem of digital self-care tools to augment, what's happening in the clinics and what's happening via telehealth and all that.
Sounds like Kaiser is doing that well. I'm just shouting very loudly at my children.
Well, there's always that. You should use that Amex and buy yourself something. Retail therapy.
Wish I had an Amex card. Wish I had the Amex Black or the Amex Green or whatever it is was wealthy enough, but clearly not.
Oh my God.
Never mind.
All right.
All right. So how are people going to find out about? We'll put the link to the Kaiser.
Oh, that's nice. You think? Yeah.
In the link, and people can shop for that later today.
That'd be great. I'd love to see you guys there. All right. Well, if this is your 2 minutes of therapy, we hope that we've delivered. How are you doing over there? We should check that. Where's the wasp?
Hang on. Where's the wasp? I'll have to look.
He's way up the drama.
No, he's way up on the window now. There he is. He is. There he is. He's still. He doesn't do much.
Are you going to attempt to kill that?
No. Leave that he'll hang out and he'll do his thing. I mean, it's live and let live. I'm doing live and let. I'm doing. That's my calm. I'm going to mellow. He didn't attack me. Why should I attack him?
You're in a Zen place. I don't know.
Totally Zen.
It's pretty remarkable being, as I can't imagine how hot it is in your office.
I'll be leaving this and heading down.
Northern California in a heat wave. Nobody has any air conditioning. So
we ain't Florida.
No. All right, guys. Well, follow along with our exploits. Hopefully you'll sign up for that AHIP webinar. I'd love to have you there. I'm at Jess Tomasa. He is, of course, at Boy, and you can follow along with us on the healthcare blog. Hey, later today, you are doing a THCB Gang, which is a live show where we bring in some of our contributors to the blog and talk about all things healthcare. So that'll be fun. What time is that one at?
That is at 1 p.m. Pacific, 4 p.m. Eastern. I have two guests, Steve Wardell and Maggie Carey, who are joining some of the regulars. So that'll be fun.
Awesome. Great. Look at us. Everywhere.
I'm going to have to do it in this office at 1 p.m. Oh
my God, can we introduce another hornet? I think we should introduce a murder hornet every 30 minutes and then see. And I want your blood pressure monitored. That would be amazing. Okay, on the next Health in 2.0. Thanks for joining us.